I'm delighted to be here, so thank you for inviting me. As Liz said, I'm Professor of Children's Rights at Edgehill University. I've previously worked in mainstream schools and in pupil referral units for children who've been excluded from school. And as a teacher, I was always aware of the importance of listening to children. And in the mid-1990s, after completing my PhD at Sussex, I was actually lucky enough to work with Michael Fielding and get involved in research focusing on listening to children. And my work has grown from there, and the focus is now around children's rights and the importance of educating children about their rights in a way that enables them to uphold their rights and those of others, especially in cases where their rights aren't respected. And my talk today is around children's right to be heard. And I want to focus specifically on how the COVID-19 pandemic has impacted on children. In some cases, there's been positive impacts, but in many cases, the outcomes have been exaggerated, and it's exaggerated the inequalities in children's lives. And given this, we really do need to acknowledge children's right to be heard as we move forward and support children, particularly those who've been negatively affected by the pandemic. By children here, I'm referring to the UNICEF definition of children, and that's children and young people up to the age of 18. Next slide, please, Jenny. I want to start by thinking about a global context and just highlight a few facts about the impact of COVID-19 on children globally. There are approximately 1.7 billion children in the world, and Save the Children report that an estimated 99% of children worldwide live in one of the 186 countries where there's been some form of restrictions and that have been implemented due to COVID-19. It is important to say that not all outcomes of the pandemic have negatively impacted on children. Queen's University Belfast launched a global survey for 8 to 17-year-olds to find out about their views of life with COVID-19. And children reported many positive experiences, including seeing more of their parents, having more time to read and relax, being able to do schoolwork at their own pace, less bullying and more time to pursue hobbies. However, I'm going to focus on some of the negative impacts of COVID on children, where children's lives have been worse due to COVID. In particular, children, these are particular children we should be listening to so we can learn on how best to support them in the future as we hopefully move out of COVID. In January of this year, the United Nations Committee on the Rights of the Child reported that the number of children living in poverty has increased by 142 million in the past year. And in a summary of the meeting, it was noticed that the closure of schools has had a devastating impact on children, with the United Nations Secretary General referring to the situation as a generational catastrophe. And research by Save the Children found that more than 3 in 4 households reported income loss due to the pandemic, with poorer households being hit the hardest. And as a result of more families being pushed into poverty, there's been an increase in the number of children experiencing acute food insecurity. Also in January, UNICEF reported that 1.5 billion children worldwide have not been able to access in-school education, resulting in nearly 370 million children who rely on school meals not receiving these. Now, given that so many children haven't been able to access in-school education, it's also significant that more than 2/3 of the world's school-aged children do not have internet connection in their homes. And this, of course, has increased the divide between children who can and those who can't access online home learning. Added to this, Save the Children predict that at least 10 million children will not return to school because their families will need them to go out to work, with girls and the most deprived children being the most affected. So huge impact worldwide due to COVID on children and children's rights. I want to take a little look closer to home now. Next slide, please, Jackie. There are about 15 million children in the UK. And children who were already experiencing poverty have become worse off. And an estimated 300,000 more children in the UK have been pushed into poverty as an outcome of their parents losing jobs or being furloughed due to COVID-19. And UNICEF undertook an assessment of what COVID means for children in the UK and children's rights. And they identified complex and multifaceted issues and risks facing children in all areas of their lives, including education, health, poverty and play. And some of these issues related to a reduced access to healthcare, as services were overstretched, and also as children and families, if they weren't already in a system, they had difficulty reaching services. There were also issues about food insecurity due to job losses impacting on family incomes. And you probably remember it was reported in the news, the fact that some children entitled to free school meals weren't receiving these, as they weren't physically in school. And there's reports of poor quality and the small quantity of food being delivered to some children in place of school meals. The photo on the slide here shows what one family received for a week's worth of school lunches for their child. And the news story that accompanied this was that companies providing meals were doing so at a huge profit to themselves, so the money allocated for food for children's lunches wasn't going to where it was intended. There's also reports of increased anxiety and stress amongst children and young people, and this wasn't helped by the unsettling impact on children caused by the end of year school exams being disrupted. Also, more children are witnessing or being on the receiving end of domestic abuse, with some children experiencing new or more persistent abuse at home. Now, of particular concern is that the mechanisms on which children rely for support, typically available through education, health and social systems, have been less available since the start of the pandemic. So this has increased the effects of COVID-19 on children who are experiencing some of these negative situations. Next slide, please, Jackie. So we've looked briefly at the global context and at the situation in the UK. And I want to now look specifically at the situation for some of our most vulnerable children in England, as the fact that many haven't been physically present in school has led to particularly worrying outcomes. There are approximately 12 million children in England. There are around 2.3 million children living in vulnerable family circumstances. That is, families where there's severe poverty, domestic abuse, parental mental health issues, parental substance misuse, or where a child or a young carer has a parent in prison. Of these 2.3 million children, 829,000 are invisible to the state and not receiving any support. A further 761,000 of these children are known to children's services, but it's not clear what level of help they're receiving, if any. So that's 1.6 million children living in England in risky family situations who we don't know what, if any, support they're receiving, and many are completely under the radar. What's even more worrying is that the pandemic has led to a weakening of the support received by these already vulnerable children because of a temporary reduction in services, including a reduction in what would have been routine home visits by professionals concerned with the care of these children. And a further concern is that trends show that during times of financial hardship and stress and anxiety, more referrals are made to children's services with regard to concerns about children's well-being, but there's actually been a reduction in the number of referrals in the past year. For example, between April and June 2020, there were just over 41,000 referrals, but this was 18% lower than for the same period for the previous 3 years. Now, it's not that there's been a reduction in the number of children who need support from children's services. The fact is that due to children not attending school or clubs or other organisations intended for them, many issues are going unnoticed, and there's no one to refer these children for support. And it's more difficult for children themselves to report issues as they're seeing fewer adults who they trust to whom they may have reported any issues. Next slide, please. So I've painted here quite a worrying picture for circumstances some children are facing. And in thinking about how we move forward now, I want to draw attention to the United Nations Convention on the Rights of the Child, published in 1989. As many of you will know, the convention has been ratified by all countries across the world, apart from the United States of America, and it was ratified by the UK government in 1991. Under Article 12 of the convention, children have a right to express their views, and there's a requirement to listen to the views of children on all matters affecting them, with their views being given due weight in accordance with their age and maturity. Now, there's generally a lack of opportunities for children to be involved in discussions and decisions about matters that impact on them. And UNICEF acknowledged that the voices of children have been absent from discussions affecting their lives and their futures. And on a more global scale, in a recent meeting of the United Nations Committee on the Rights of the Child, children were referred to as the silent and silenced victims of the pandemic, stating that children must be listened to and their proposals should be heard. So what's happening in reality? In England, in an effort to seek the perspectives of children, the Department for Education opened a consultation earlier this year on how GCSE and AS and A-level grades should be awarded in summer 2021 to those students expecting to sit these exams. Now that's great, consulting with young people about matters affecting them. However, in order to respond, students needed to be aware of the consultation in the first place. They needed to have the resources to respond online and to possess the literacy skills to understand the 64 questions posed in the questionnaire. So the reality was that this consultation was open to a limited number of young people, and significantly, young people were not involved in the data analysis or the decision-making processes about what happens with the data and their responses. So as a consequence, while this represents a positive move towards listening to children and young people, it only partially acknowledges children's rights under Article 12 of the UN CRC. More recently, the new Children's Commissioner for England, Dame Rachel de Souza, launched the Big Ask for Children and Young People. And this is open to children and young people of different ages. It's the largest survey on children and young people conducted so far in England. And I know there's been over 500 respondents. Within this survey, children are asked how they feel, whether they're bored, whether they're happy, how happy they feel with their friendships, about education. They are asked about how active they are, about their family life, their family's health, how they feel about their local area, about their progress at school, about their mental health, their physical health. So it covers several aspects of their lives. And while I see this as a really positive move, time will tell about what happens to the information from the survey, who's involved in the analysis and making decisions about addressing the issues raised by children and young people. And of course, crucially, which issues are given more weight than other issues. So the reality of implementing Article 12 in respect to this survey will depend on what happens now to the survey responses. Slide 6, please, Jackie. So even with these measures in place to listen to children, it doesn't get away from the fact that given the profoundly negative impacts of the COVID-19 pandemic on some children, particularly some of our most vulnerable children, there needs to be significant changes to systems and processes relating to services and situations which impact on the lives of children and young people, so that these acknowledge children's right to be involved in decisions about matters that affect them. And while there might be disagreement about whether some children are capable or sufficiently mature to form and express their views, what is evident is that there's an obligation to listen to children, and not taking children's views into account is clearly contravening the requirements of Article 12. So I just want to end by saying, as we move out of this pandemic, children should be round the table and fully involved in discussions and decisions about measures to be implemented to support their education, their health, their well-being and their future lives. Thank you.